Thank you, Isal, the participants, and all the people contributing to this important meeting. We as liver patients should give updated and useful information to our peers and citizenships in general about NAFLD and NASH and its consequences, because it has medical significance, but also social. Elpa considers that as representative of liver disease patients in Europe, we need to be prepared to face current challenges, and we feel the need to talk about stigma and obesity. We are also worried about the effects of obesity in children and in young adults that at present might affect their health and quality of life, as well as in their future. NAFLD-NASH patients require more information. We should not only take into account liver disease, but more and more cardiovascular complications, diabetes, obesity, etc. Sharing protocols should be mandatory in order to avoid complications, preventing emergency visits and hospitalizations, and improving quality of life and survival. Patients want to have more updated information on NAFLD and NASH, favoring adherence and control. Information should be scientific and based on real life, and it should also be easy to understand. Currently, we do not have drugs available for treatment of NAFLD, but this does not mean that doctors should not identify those patients that could have more risk to develop severe liver disease. Obesity, liver transplant, and children with NAFLD are topics which will be covered now from the patient's point of view. Then we start with the first case. I introduce Maite Pujol, who is a patient with morbid obesity who needed bariatric surgery. Please. This presentation should be done in 3 parts: the medical follow-up with a short summary by myself, considering the medical history; the second part, the perceived quality of life as a personal approach; and after, some comments as conclusions. Maite now is 63 years old. She's a wife and mother, but her son and her husband died from cancer. She's administrative accountant, and now her social activity is volunteer in grief groups. Her diagnosis as a chronic problem of health is obesity, or her life, and as comorbidities she had hypertension and obstructive sleep apnea, no alcohol, no tobacco, and the management was done by her primary care doctor. For years, her treatment was lifestyle modification and hypocaloric diet. In 2017, her weight was 110 kilograms. Her BMI was 44. The diagnosis of obesity, and morbid obesity, with lab alterations, abnormalities as elevated ALT, AST, cholesterol, and triglycerides, and in the abdominal ultrasound, they discovered steatosis, liver steatosis. Other causes of liver disease, such alcohol, medications, viral hepatitis, were ruled out. Then her primary care doctor recommended a visit to endocrinology to advise and inform about bariatric surgery. She started bariatric surgery protocol with visits to psychiatry, pulmonology, gastroenterology, surgery, anesthesiology, etc. And each specialist allowed to move on to the next, and at the end, she was accepted. She started in this moment in the third step phase of the NAFLD, and she needed the intervention for morbid obesity. Now we can listen, please. How was your personal experience? We can share her experience.
Hola, buenos días.
Hi, good morning.
He pasado la vida con sobrepeso.
I've been with overweight since I was a child, I would say.
Al llegar a la adolescencia,
When I was an adolescent, I tried to diminish, to lose weight between diets. I think I tried them all. Hypocaloric diets, dissociated diets, shakes, dots diets, and etc.
al final me cansé.
At the end, I got tired of it.
Con mi vida como
I just moved on as I could, and I got used to my
lo
weight.
consideraba una cosa normal.
I thought it was something normal.
Con el paso de los años y de las
In
circunstancias
time
personales,
and with the circumstances that I had in the family that were very
no sabía
difficult,
cómo gestionar
I
mis
didn't know how to manage my
y
emotions.
me compensaba con la comida.
And then food was my compensation, even with binge eating after some bad
A
news.
continuación,
After
seguía la
that,
oscura que
the
todos
side
tenemos.
dark that we all have came out, feeling guilty.
Círculo vicioso
A difficult catch-22, and it was difficult to get out of it.
Intentaba otra nueva
I
dieta,
tried
con plena
another diet,
conciencia,
and I was really
y al
aware of
aparecer
that.
otro
But when
acontecimiento
something
inesperado,
unexpected
volví a
came
comer
up,
de forma
I
compulsiva,
just started eating,
ganando y superando el
binge
peso
eating
de
again,
facto.
and I was getting fatter and fatter.
Era el pez que se mordía la cola.
It was a
Un
catch-22,
círculo vicioso difícil de superar.
very difficult to overcome.
Los graves problemas de
The
salud
serious
de mi
health
familia
problems in my
mexicana
close
me
family
impedían ver
prevented
mi
me from
situación
seeing that
física
my
empeoraba.
physical state was getting
Solo me
worse.
limitaba a cuidarlos
I
con
just
todo el amor
wanted
del
to
mundo. No
take
quería
care of
darme
them.
cuenta de mi
I
estado
didn't want to
físico.
realize by my physical state, and on top of it, I justified it. I was an asthmatic since I was a child, and I said, of course, I'm getting tired because I am an asthmatic.
Duermo mal,
I slept badly. Well, I sleep badly because I'm nervous. I was getting fat and fat. Of course, I gain weight because I'm growing old. Not everybody has been born to go to the Olympic Games, and so on.
Aunque lo justificaba con humor,
I justified it with a sense of humor, but my self-esteem was really, really low.
mi situación familiar
My
era
family
cada vez más
situation
complicada.
was more and
Cada
more
vez me
complex,
dedicaba menos a mí misma.
and I forgot
Solo
about
tenía que
myself.
quererme un poquito
I just
más.
needed to love myself a little bit more, but I couldn't.
Mi estado físico
My physical state, my physical condition apparently was acceptable, but it was not real.
mi salud podía empeorar
My
sin
health
yo
could
saberlo.
get worse without knowing it, and I was proposed bariatric surgery, and I just let myself be carried away.
Al acudir a la primera
When I went to
visita
the first
del
visit with the
especializado en
endocrinologist,
cirugía
who was
bariátrica,
specialized in
me
bariatric
entregaron un
surgery,
dossier para firmar
I was
la
given a
autorización de
dossier
todas
to
las
sign
pruebas
my
y de la
authorization for the tests
cirugía.
and for
Confiese
the
que tuve ganas de
surgery.
salir corriendo,
I
no
just
para
wanted to
correr,
run away and
sino
not
para huir
to
de
do
la
sport,
realidad de
but
todo
to
lo que me podía
escape
pasar.
from reality of
Pero
what
me
could
dije,
happen to me.
"Maite, tú pa'lante".
But I said to myself, Maite, you move on, and I just let myself be carried away. I went through the different visits and through the different tests. The first was psychiatry. That was based to move on. I had to answer a long dossier that revealed my emotional situation and my personality. I went through the different visits with a lot of obstacles because I had Helicobacter pylori positive in 2 controls. I had 2 different treatments of antibiotics to eliminate it. The sleep test was not good either. My personal circumstances that day didn't help either, but that doesn't justify the result. Serious apnea and the need of a CPAP device to control the apneas. I didn't adapt to it. While being in the process, the dietitian service was giving me advice about all the visits I had to go. The coordination among all the members of the team through my medical record, I suppose, was correct. But as far as I was concerned, I lacked information. They have a maximal number of patients every month, but the patient didn't know exactly the moment in which he was presented. I would have preferred to know my personal situation at every moment. The most stressful thing was when I had this abdominal ultrasound. I felt that something was wrong. Initially, there was a resident doctor, I think. His examination took a long time, and that I was really worried about it. He called another doctor with more experience, I think, and it took him another while. I was getting more and more nervous, and I asked myself, what's wrong? Is there something wrong? What can you see? And then the worrying, laconic answer from the doctor. Your doctor will tell you about it. That didn't help me. On the contrary, I was getting nervous, and that created uncertainty. I insisted again, and he said, you're going to get operated, right? Okay. I thanked for his answer, and I thought that there was something wrong with my liver. Fat, I supposed, and I was not wrong. The day of the operation was 24th of April of 2017. A week earlier, I started hypocaloric diet with shakes and broths. Then I had a sleeve, the surgery, and I was discharged the following day. The weight loss was gradual with the supervision of a dietitian, first liquids, and then some food. Everything was controlled. Although my personal circumstances, my self-esteem was going up due to the weight loss. Today, I don't escape when there are pictures being taken because I don't have this desire to hide in order not to see myself. Thanks to bariatric surgery that was done at the right moment, I think my health didn't get worse, but my blood analysis improved, also my quality of life, and I don't need the CPAP device to sleep. Who knows? If that hadn't happened in the right moment, what would everything be like now, and what my life would be now? Thank you very much.
Thank you, Maite, to share your experience. We follow a little more. Thank you. Some definitions. Bariatric surgery, because it's a strange word, is a surgery that produces weight loss and metabolic benefits. Bariatric surgery reduces long-term mortality, morbidity, and healthcare use in obese patients with BMI more than 40. But we should take into account that the procedure's invasiveness and cost. The inherent risk, once NAFLD has progressed to cirrhosis, limits its potential as a widespread treatment for NASH. And some words about quality of life. This is some graphics about quality of life. You can see the bars, and you can see the scores after the questionnaire, a generic questionnaire of quality of life, the SF-36. And you can see three different populations: cirrhotic, non-cirrhotic NAFLD, and general population. And you can see that patients with NAFLD, cirrhotic or non-cirrhotic, the scoring are always less than general population. They mention the most commonly reported issues were in relation with her frustration with diet, reduced and disturbed sleep, and the problem with social and family activities, also the medication and healthcare disappointments, and the additional subject they mention, the fear for the future. Some comments about what includes when they talk about fatigue is meaning they have tiredness, weakness, lack of energy for doing the normal activities. They have pain, not sometimes not real pain, but alterations, nausea, perceiving bloodness of the stomach, abdominal issues, social and emotional problems, and some unclassified symptoms, such difficulty concentrating without liver encephalopathy, and sweatiness. This perceiving clumsy or clammy hands, mucha sudoración. So the conclusions in Maite's case is the limited awareness of the connection between obesity and liver health, limited awareness of the importance of liver health by health professionals in general, and poor care preparedness to provide multidisciplinary care and information, participating and sharing information in each moment of the control and management. We need more research and more information about health-related quality of life in NAFLD and NASH people, and bariatric surgery, considering that it is an excellent treatment for obesity and obesity-related conditions, based on the scientific evidence. Healthcare systems should support increasing accessibility to bariatric surgery for eligible patients. Now Maite is joining the dots. Now she realizes what was the process she had. She received this diagnosis of hepatic steatosis, and this was apparently the first step of the correct way to treat her problem. And after, at the end, the conclusion is Maite participates in group pictures. So that is the end. Thank you for your attention.